Welcome, everybody. My name is Laura Davis. I'm here from I'm the technical lead at the Heart of Stigma at the IAS, the International AIDS Society. And we're very pleased that you are able to join us this morning, afternoon, evening, wherever you are in the world. Thank you very much for joining us today. Could we have the next slide, please? Nous avons des interprètes avec nous aujourd'hui. Si vous souhaitez écouter en français, il faut cliquer sur le symbole du monde en bas de votre écran. So a few little housekeeping rules. You will notice that participants are muted. If you have questions, we ask you to use the Q&A box, not the chat box. So you will see there is a Q&A function and post any questions in there. We will have a question and answer session at the end of the webinar, and there should be plenty of time for your questions. So you can post them throughout, and we will then field those to the right people to answer them towards the end of the webinar. As I said, there is live interpretation, and we also are recording this webinar. It will be available on the IAS Plus platform afterwards, along with a link to the tool that we are here to talk about today. So this is our programme for the webinar. I'm going to spend a little bit of time introducing the tool to you, showing it to you and explaining how it can be used. Then we have some colleagues here representing different global initiatives to talk about how the tool connects with their work. So we will have a few minutes to discuss that with each of them. And then we will go on to a panel discussion with some people who have already trialed the tool in both Ghana and Kenya, where they will be able to share their experiences and hopefully answer your questions in a very practical way. So let us begin with me introducing the tool itself. I wanted to begin really by thanking you for taking the time to join us today. I realise that this is an extraordinarily busy time and a very challenging time. We have fewer and fewer resources to work on HIV-related stigma and discrimination. And for that reason, prioritisation is absolutely essential. And we are hoping that this new National Stigma and Discrimination Review and Planning tool will be something that you find useful to help facilitate conversations in your country among national stakeholders to review what interventions are working and to prioritise where to invest to improve the quality and the impact of programmes. The tool is designed for you. It is not something that is required by any institution anywhere. It is purely to be used as you find most useful. The reason it was developed in the first place is because we had some consultations with a wide range of stakeholders at national and global level to see whether people felt there was a need for a tool such as this. And the vast majority of people felt it would be useful. So the tool was developed through a long process of consultation with national and global stakeholders. And as I mentioned, there have been some small trials using the tool in both Ghana and Kenya, which helped us to finalise the tool and get it to the point where it is now ready for use. So we are very pleased to be able to share it with you today. We actually have a short video which shows you the tool and how it can be used. So I'll begin by showing that to you, and then I'll actually show you some elements of the tool and talk you through how it works.
The most valuable
You
thing
were
about
meeting. I did network no
impact us to have. The biggest challenges for the HIV response now are stigma and discrimination and lack of financing. This tool will help us prioritize actions to reduce stigma and discrimination and raise funds to support these.
We appear to have been addressing stigma for years, but not getting anywhere. This tool can help us hold stakeholders accountable in addressing stigma in a more meaningful way.
In a few days, we took steps forward together that would usually take months.
There is so much great work being done by different partners. It was energizing hearing what everyone has been doing and the lessons they have learned. I have come away with a clear focus for our country for next year. This tool has been created to spark conversation, self-reflection, and progress on the work being done to reduce HIV-related stigma and discrimination in your country. The tool is designed to facilitate honest and open conversations in a workshop of national stakeholders. The process will need to begin with a consultant conducting a desk review to pull together the current evidence and data on HIV-related stigma and discrimination in your country, who it affects, and what is being done about it. Then you can hold a workshop that brings together all the key stakeholders to discuss the findings and agree on the top priorities for the coming year. They will talk about what is working, what should be scaled up, and what new interventions could be trialed. The tool doesn't have to be submitted or reviewed by anyone. It's a living document for you to use to track the progress being made in your country to reduce HIV-related stigma and discrimination. It's filled out live during the workshop and should be repeated annually to help guide work plans and budgets. You'll find it most useful if you schedule the workshop ahead of key times, such as the national budget setting, funding proposal development, or strategic planning. Or if your country is part of the Global Funds Breaking Down Barriers initiative, make sure you plan the timing to coincide with the BDB self-assessment process that takes place at the end of the year. The workshop should be organized by your country's Human Rights or Stigma and Discrimination Technical Working Group, if you have one. Make sure to include government and community leaders, donor development partners, and others.
By completing the tool, you can help accelerate progress on reducing HIV-related stigma and discrimination in your country. The conversations you have will bring stakeholders together, making you better coordinated and supporting you to use all the existing data to develop a shared analysis of the situation in your country. You'll be able to discuss how to address the most critical challenges and improve the quality of interventions, prioritizing areas for action and investment.
The tool has been created for you. As people commit to reducing HIV-related stigma and discrimination, you can use it to push for bolder action.
So that's a little introduction to the tool. As you can see from this slide here, the tool is basically an Excel spreadsheet. What we've done is we have gathered all together within this one Excel document, not only the tool itself, but also all the guidance that will help to show you how to make the most out of the tool. And they're all gathered within the one document. So the video is there, plus the extra guidance, and they're just accessible via the different tabs at the bottom of the Excel. So hopefully it's a simple and user-friendly kind of tool. If we go to the next slide, please. So the tool has been designed so that it works with what is already in place within your countries and existing processes. So it draws on the data and evidence that you will be gathering anyway, and that is gathered through all kinds of different processes, such as the People Living with HIV Stigma Index, but also things like GAM, the UNAIDS Global AIDS Monitoring, the Global Fund's breaking down barriers assessments. All these different processes will be gathering data and evidence, and they can feed into this tool. The tool is then designed to help to feed into other processes, such as your planning and budgeting processes that will be going on within your country, whether that's national HIV budgeting processes, or whether that's about developing a work plan for human rights technical working group, or maybe just putting into practice your global partnership commitments for the Global Partnership for Action to Eliminate All Forms of HIV-related Stigma and Discrimination. All of those things can be supported through the use of this tool. Can we have the next slide, please? So this, I appreciate you can't read all these little steps, but this is all included within the tool itself. There are these infographics that help to show the key steps that need to be followed in order to use the tool. So the idea is that the tool is completed during a workshop, and that there are certain steps that need to be taken before that workshop can take place, to make the most of the time that you then have together completing the tool during the workshop. And then there are some other steps that take place afterwards. And this is a cycle that would then be repeated. Ideally, the tool could be used every year to review the previous year and to plan for the following year. Thank you. So within the tool, there's some further guidance, which is sort of in the form of some frequently asked questions. So there's a series of questions that hopefully would answer any additional questions that you might have, or anything that you might not be sure about. And then if we move on to the next slide, this is the actual tool itself. So it's really just 4 tabs within the spreadsheet. And this first one focuses on problems and priorities. This is something that would be completed partly by a consultant. So what we are recommending is that before you actually sit down in a group together to complete the tool, a consultant is contracted to have a look at the data, pull all the evidence together in one place, and help you prepare for the workshop. So they would have completed this first part of the spreadsheet, and then as a group together in the workshop, the main focus would be to identify some priority areas to work on in the next year. And we're suggesting that that should be a maximum of 6 priority areas. And those can be, they could be anything at all, but for example, it may be to focus on young people and internal stigma, or it may be one priority may be to focus on key populations and the discrimination that they face within healthcare settings. So it can be a fairly precise focus like that, and you may choose just 3 or 4 or up to about 6 priorities to focus on in the following year. The next tab then looks specifically at the interventions interventions and outcomes that would accompany each of those priority areas. So it begins by encouraging you to look back at what existing interventions there are that relate to each of those priority areas that you've identified. And then it takes you through a process of deciding on priority actions for the coming year, what interventions you think should be the priority for each of them in the coming year. And there's an option to include some indicators if you think that would be useful as well. Then the next tab focuses on management, resourcing, and monitoring and evaluation. So all the foundations that are needed to work on stigma and discrimination. And for each of these, there is a little column where you look at how you're performing in those areas, and then another column that gets you to look at whether there are any priority actions that need to be taken over the coming year to improve performance on these areas. So the areas are, the first one is program management and coordination. The second one is finance and technical resources. And the final one is monitoring and evaluation programs. So this is really all the building blocks that you need in place to be able to then do the programmatic work that focuses specifically on stigma and discrimination. And this part of the tool focuses on that. Then the final page of the tool is really there to help you put together a work plan. So this is all the detail of the actions that should be taken. So a lot of this gets automatically completed as you go along. So as you have completed the first few sheets, first tabs in the Excel spreadsheet, you will then have some of this will automatically have been completed for you with the priorities that you've identified and the priorities that you've decided on for that foundational work that I was just talking around about M&E. And then at this point, what you would be looking at is for each of those things, what are the next steps? Who's going to do it? And when will it be done? So not only will this help you create a kind of work plan, but it also can serve as an accountability tool so that you can look back and see who should be doing what and see that you are on track. So those 4 tabs are really the bulk of the tool, and hopefully it is very clear and you are guided through it as you complete it. There are then a few, there's an extra tab afterwards, which is purely some useful guides, tools, resources that we have got links to there in case they're things that you find useful, because there's a wealth of resources out there and some of them are probably not used as much as they could be. So these are listed, some of the key ones are listed on a final tab. So that really is, in brief, the tool itself. If we could go on to the next slide, please. The tool is designed, as I mentioned earlier, to sort of fit into the bigger picture of what else is going on within countries and at a global level to do with reducing HIV-related stigma and discrimination. So it is hoped that the tool will help countries to review programs, plan strategically, but in particular support countries to deliver on political commitments. So, for example, many of you who are on the call are probably in countries that are members of that have signed up to the Global Partnership for Action to Eliminate All Forms of HIV-related Stigma and Discrimination. You will have made commitments through UN political declarations. So hopefully this is a tool that can help transfer those commitments into some concrete action. Also, the tool is designed to help prioritize investment in this area, because obviously that is key, is to get investment into human rights, domestic financing, as well as donor funding. And at the moment, obviously that donor funding, it's a very challenging picture, but there are still different sources of funding that will continue, including Global Funds funding and the Breaking Down Barriers initiative in particular. So before we have our panel conversation with colleagues in Ghana and Kenya who have trialled this tool, I thought it would be helpful to take a moment and just introduce, first of all, Simone Salem from UNAIDS, who is she has a very key role in coordinating the global partnership that we've mentioned. And I thought it might be helpful if she just explains briefly how this tool can help complement the aims of the global partnership. So welcome, Simone. Thank you for joining us. And it's over to you.
Thank you so much, Laura, and thank you so much, everybody, and for being here. And I just want to first just take a moment to thank IAS for this initiative and also for the engagement of all partners in the consultative process to the development of the tool. That has been really much appreciated. Let me also start by giving a quick background to the Global Partnership, just in case people are not aware about how it had started. So the Global Partnership was launched in 2018, focusing on 6 settings where people living with and affected by HIV face the most discrimination, which are healthcare, workplace, education, justice system, community, and emergency settings. Convened by UNDP, UN Women, GNP+, PCB, NGO Delegation, Global Fund, and UNAIDS. UNAIDS here acts as the secretariat. This commitment currently brings together 41 countries. We're very happy to welcome Nigeria, the last country to join, along with a diverse number of technical partners at all levels, global, regional, and national levels, all working together towards a stigma and discrimination-free HIV agenda. And among those partners, of course, IAS, and that's why we're excited to continue this collaboration today with the launch of the assessment tool. We believe this will be critical in helping countries to track and improve their efforts to address stigma and discrimination. So first, let me say, when a country joins the Global Partnership, what does it commit to? It commits to 5 key actions: building partnerships, bringing together communities, civil society, national governments, UN agencies to work as one team. Then assessing the situation, taking stock of stigma and discrimination landscape to identify and prioritize the programs to eliminate barriers to services. Then making it happen through development and implementation of an action plan. Could be 1 year, could be 5 years, like we've seen in some countries do, Thailand, Jamaica, Kenya, and others. Then securing resources, which is important for pooling existing funds and technical support to make sure programs are well funded and effective. And of course, tracking the progress through monitoring the results every year and adjusting strategies based on the real data and evidence. So how is this assessment tool linked to the country commitments? As Laura had said, over the years, the Global Partnership and its technical partners have put together guidance and tools to help countries move forward in addressing stigma and discrimination. This includes the guidance on practical evidence-based interventions, as well as some on how to monitor and evaluate them. The self-assessment tool we're launching today is a big step in helping countries respond to the commitments of the Global Partnership. Of course, it's the first and foremost is the assessment of the current efforts and focus on what works best, but also how to build that work plan that needs to be implemented. It will also not be possible without the first commitment in place, which is an inclusive and functional multi-sectoral mechanism. And this had been really great. We've seen many countries using the existing mechanisms, whether they are global partnership committees or whether human rights committees and other commitments. The tool is not going to be implemented in silo, as we've seen also in the initial presentation by Laura. It will be informed by other equally important inequalities analysis that the Global Partnership had also been prioritizing, like the Stigma Index, the Gender Assessment, and the Global Fund Rapid Assessment and other progress assessments. So all of these should be focusing on the plans on ending stigma and discrimination. Within the community of practice of the Global Partnership, there can also be room for peer learning and knowledge sharing of the implementation across countries. What we're seeing now with Ghana and Kenya is an example. Also engaging in flagship projects prioritized by the Global Fund, by the Global Partnership, such as working on internalized stigma, gender-responsive human rights interventions, or working with youth. Just want to finalize by saying that why this tool matters now, why it's critical now. Just to be real, funding is tight, as we all know, we've seen lately. We need to prioritize smart, high-impact interventions responding to emerging needs. We believe this tool will help us do that. It will help countries focus resources where they are needed most, strengthen coordination across sectors, and this is using the settings of the Global Partnership, and align human rights interventions within the long-term sustainability roadmaps being developed. In Investing a little time and effort now into this tool will pay off big time in the future, ensuring a stronger, more coordinated response to ending stigma and discrimination. Thank you so much, and over to you, Laura.
That's so helpful. Thank you, Simone. There may well be some questions later on, so we may well need to pull you back in. But for now, I'd like to hand over to Alexandrina Jovita from the Global Fund to talk a little bit about how this ties in with, in particular, the Breaking Down Barriers initiative of the Global Fund. Thank you for joining us, Alexandrina. The mic is yours.
Thank you so much.
Oh, and please, sorry, just one thing as well for the interpreters. Please don't speak too quickly. Simone is full of information and a quick talker, so try not to go too quickly. Thank you.
I think Laura has been anticipating the speed of my speaking, doing some corrective action. Hello, everyone. Thank you so much for this opportunity to join you. And thanks so much to colleagues at IIS for the consultative process. I have had the pleasure, the same as Simone, to be part of a little advisory group, but coalition of a willing, that has been part of a process of coming up with a tool that was presented today. We're very excited to see it come to fruition. We're very excited about the consultative process that Laura and Aditi and IIS colleagues have followed, the consultations with stakeholders in countries to understand the usefulness of this tool and shaping it around those asks from stakeholders on the ground, making it fully a contribution towards an ability to prioritize, an ability to generate action, an ability to inform those actions with evidence. So I'm going to have to try to not repeat what Simone has said, because she did speak to the importance that this tool is going to bring to be able to have more concerted actions under the global partnership. We, as a Global Fund, are a co-convener of a global partnership. And the reason why we are a co-convener is because we want to see commitments translated into action. Our Breaking Down Barriers initiative that was launched in 2017 is an opportunity to get some resources, to get some programmatic action where our mouth is. We have been committed to end stigma and discrimination. We have been committed to protecting and promoting human rights as part of HIV, as well as TB and malaria responses ever since Global Fund was founded. But Breaking Down Barriers has started in 20 countries with the aim to really build comprehensive programmatic responses to human rights-related barriers. We've done it through catalytic investments. We've provided matching funds to the 20 countries. We've done it through long-term implementation support with some of the TA providers actually on the call today. And they have been working very closely with implementers of the Global Fund grants, those implementing human rights programs, of course, to make sure that we really invest in models that work. So we've had baseline assessments in 2017, midterm assessments and progress assessments in throughout the duration of a Breaking Down Barriers initiative, and that evidence has been absolutely critical to guide programmatic action. Breaking Down Barriers has supported comprehensive national human rights strategies. We've had such comprehensive national human rights strategies in Kenya across 3 diseases, and I'm sure you'll hear more from Jane and Sheila about it. We have such a comprehensive national human rights strategy in Ghana, which really brings together commitments under Breaking Down Barriers and under global partnership into one cohesive national framework. Breaking Down Barriers has also supported national oversight and accountability for those human rights working groups that are actually tasked with taking the tool forward and the best forum for truly multi-stakeholder and participatory action. So Breaking Down Barriers has resulted in significant scale-up of financial investments. We've increased the investments in the Breaking Down Barriers countries more than tenfold. Now we have 24 countries, 4 more countries have joined the group. But I just wanted to stress that what has actually made Breaking Down Barriers work is use of evidence, is stakeholders coming together to consider that evidence. Starting with the end of last year, we've moved away from assessments done by independent researchers towards country-owned and country-led processes. But self-assessments that you've heard Laura refer to when she was presenting the tool. This particular tool can be such an asset in that process. So either the tool can be used to document those inputs in terms of how the various programs in the various settings have been scaled up, or the tool can be used after the scoring process for the Global Fund self-assessment needs as part of a key performance indicator reporting and as part of a matching funds programmatic conditions. And then the tool can be used to prioritize actions so that performance improves in the next year. The tool would also be a really important asset for Global Fund funding request development for prioritizing programs aimed at addressing human rights related barriers. And as Simone has put it so eloquently, it is so much more important today given the current challenges that we are facing. So we really look forward to countries using that tool as part of a country dialogue for participatory processes that put communities at the center to come up with those programmatic interventions that work. And I saw Erika from WHO speak in the chat about the WHO technical brief, and it is a really important guidance that is also referenced by the tool. So this tool is basically a cheat sheet. It helps you make use of the existing technical guidance. It helps you make use of this technical guidance in specific points in time that are most useful for the country, be it because of a Global Fund funding request development, or be it because of an annual self-assessment, or be it because you're reviewing your national strategic plan, the human rights one or the general HIV/AIDS one. So let's make that tool as useful as possible. Let's use it and let's engage in prioritized actions that work so that we can finally end stigma and discrimination for good.
Thank you, Alexandrina. You are very inspiring, as always. It's really good to hear from both you and Simone about this sort of bigger picture and how the tool fits in with all these really important initiatives that are already taking place, and hopefully doesn't duplicate but helps to strengthen what is happening. What we want to do now is focus on country level and what this really looks like in reality in country. So we're going to have a panel discussion with some colleagues from Ghana and Kenya. And to lead that conversation, I'm going to hand over to my colleague at the Heart of Stigma program, Aditi Sharma.
Thank you, Laura. That was an excellent introduction to the tool. And as Laura says, we're here now to kind of come back to kind of really the people who are going to use the tool, the country level, not just different stakeholders at country. This tool is meant to be a multi-stakeholder tool. So it's kind of very much designed to be used by governments, community, and other partners like donors and UN agency. It brings together and facilitates conversations. So you'll be hearing from a panel that reflects that. But as I ask our panelists to put on their cameras, maybe to all of you to say, we really want this to be interactive. So please put your questions or comments in the Q&A box. Please use the Q&A box to submit some questions and comments, even as you're hearing, and we will put those to the panel after I've asked them a few questions to start with. So John, Elsie, Sheila, and Jane, please will you put on your cameras and join me on the panel. So maybe starting with you, John Mahama from the Global AIDS Commission. You know, amongst many of your responsibilities, you also coordinate the Human Rights Technical Working Group in Ghana. And as Alexandrina said, it's an incredible group because it supports, again, among other initiatives, the BDB, the Breaking Down Barriers Initiative, and the Global Partnership. So it really brings everything together. In December, you decided to pilot the tool despite a really packed agenda for the Human Rights Technical Working Group. Why did you prioritize piloting this tool? Why did you think it was so important?
All right, thank you very much. And let me start by saying thanks also for the opportunity to be part of this process. I think the tool really came to us at a very critical moment. Our human rights strategic plan here in Ghana covered the period of 2020 to 2024. So the existing plan was ending last year, but also in the last quarter of the year, we were planning our activities for 2025. So even though it was a busy period in December, with the World AIDS Day, with elections, and with the reconstitution of our CCM that was also ongoing, the country coordination mechanism that was ongoing at the time, we felt it was really at an opportune moment because we needed to have a clear plan of what our priorities are before the end of the year. And so when we heard about the tool, we thought it was really coming at the right time and a great opportunity for us, and also to help inform the ongoing process right now in the review of our human rights strategic plan. To put it a bit more in the stigma and discrimination context, really, stigma and discrimination remains a key challenge in the national response to HIV, and the rates of people that express non-accepting attitudes towards persons with HIV is really very high, above 70% from the 2022 Demographic and Health Survey. And so really Ghana joining the global partnerships and also being a member of the Breaking Down Barriers initiative, we thought these present a critical opportunity for us to leverage on the resources that are available to inform our programs, to bring stakeholders together. And so that was really the critical, the main reason for joining, for taking advantage of the tool at that particular point in time. And I think really doing so was very helpful for a number of reasons, many of which have been mentioned, because in addition to the tool helping us to assess the state of interventions, state of where we were in a number of areas, it also played a critical role of helping us in prioritizing and in planning for this particular year. And I think that when we use it again next year, it would also help us to track where we have made progress and to see where we need to make adjustments. But what was also critical for us was the fact that we could use an existing mechanism. We already have the Human Rights Technical Working Group, and where it was necessary, in fact, at several points, we brought in a few stakeholders to ensure that we had the right people in the room to have the conversation. So really building on that existing system that was in place and bringing on board a few colleagues from the country coordination mechanism and also other community actors to ensure we have the right people who were in the room to have this conversation was really critical. And I'm sure for civil society, it can also be an accountability tool for them to use in following up and tracking progress and holding us accountable. So really, thank you. And I think those will be the few words for now.
Thank you, John. We might pull you back in on a few, so please stay with us. But I wanted to ask Sheila, as a researcher, as an independent researcher in Kenya, you have contributed to kind of many national processes, including the Global Fund's Breaking Down Barrier initiative, the self-assessment for that. And you also helped in us with the pilot in Kenya and did a very rapid scan. So Laura, kind of right at the start, mentioned how the role of a consultant kind of set up this evidence for the workshop to be successful, and a similar process was followed in Ghana as well. I'd kind of like to really ask you about this linkage between the Breaking Down Barrier Initiative self-assessment and this tool, and where you see kind of synergies and advice really for other Breaking Down Barrier countries when they conduct this tool to facilitate conversations.
Thank you so much, Aditi, and thank you, everyone. Good afternoon. I hope I'm audible enough. I think for starters, where, of course, the synergies would be experienced and where we probably want to avoid duplication is by, of course, ensuring that, and it was mentioned earlier, ensuring that we are aligning both processes, of course, with the existing national processes. And this is really for us to be able to leverage on all the existing data sets so that we are able to, of course, avoid this reduces on the duplication and also complementing existing efforts. For us in country, I think it really helped that we were, this came at a time when we were just finalizing the the progress process for the country, and so the data sets could speak to each other. So I think the fact that for countries, particularly the VDB countries, it's really important that these processes are aligned with the existing national processes, including various aspects. Even for us, I think the timing was perfect as well, because we were also just from receiving results from the stigma index as well during that time. And therefore, this kind of alignment, I think, really made it easy for us to be able to test the tool, because all the available data sets were able to be interconnected on the same platform, including what had already previously been done while we were doing our self-assessment as a country during the KPI EI process for the Global Fund. Secondly, and of course, I think and probably linked to the whole idea of aligning of the processes, is where possible, and particularly for BDB countries, if there exists a BDB consultant, then that would be a very good starting point for supporting particularly the rapid assessment, because then this is a person who's already familiar with the processes, familiar with the various data sets, familiar with the various assessments, and is able to do a very quick assessment and bring everything together, including the stakeholders, on a similar platform. And therefore, where possible and where not, then you're able to have someone, the TWG is a starting point, someone who's still familiar with the processes, someone who's still familiar with the work around stigma and discrimination, really helps in navigating the whole rapid assessment prior to the beginning of the utilization and testing of the tool. Thirdly, of course, is the early and timely engagement of stakeholders.
Can you speak a bit? I think there are network issues, but also if you can speak a bit slower. Thank you.
Oh, okay. Oh, sorry. Thirdly is the early and timely engagement of stakeholders. And as mentioned probably by other speakers as well, the TWG is a good starting point. But once you're putting together the list and probably the participants, I think once you're able to still see that probably it's not as representative enough, and probably does not probably include the entire cross-sector collaboration, then you're able still to add a few more. And this really supported us from the start, the engagement of the various stakeholders and players. I think we did a very good assessment of who needs to be on board as we piloted this tool. And this really ensured that the various thoughts and ideas are brought on board the same platform, so that we ensured the synergies and avoided the duplication of various other information that was coming in from various data sets. Lastly, and ultimately, to support sort of a sustainable implementation across board, is advocacy for probably long-term accommodation of both of these processes in our national strategic plans and our national processes that most of the BDP countries actually do. And so for us, I think it would be important that this is also captured in our national plans, such that we are able to actually have this implemented more sustainably in terms of both utilization of the tool and having all processes speak to each other. And so these are just some of probably the points that I would give in terms of ensuring that both the processes run smoothly, complement each other as opposed to duplicating each other, and also where possible, that they are able to maximize on the synergies that both processes bring on board. Thank you.
Thank you, Sheila. That's a really critical point about, especially now, to be talking about kind of the sustainability of this and collecting ideas. And I might come back to all of you on that again. Jane Mukami from the NSDCC in Kenya. I know Jane's video, she's having trouble with her video, so she won't be putting it on, but we'd really, again, appreciate you piloting the tool in Kenya in January, And as the coordinator of the Human Rights Technical Working Group in Kenya, you know, what are some of the key lessons from that pilot that you want to share with other countries who might be interested in the tool?
Okay, thank you so much, Anditi and colleagues. My sincere apologies on the camera bit. I will, however, be able to share on some of the lessons that we have been able to learn once we piloted this tool. That was on 31st January, beginning of this year. First is to say Kenya was really privileged to be part of the country that was able to pilot this. And one of the first lessons that we were able to learn is that the tool is quite comprehensive, and it allows the country to be able to collect evidence that really informs how to continue programming on stigma and discrimination. It also allows the countries to track progress over time in addressing stigma and discrimination, which might really be lacking in some of the countries. And one of the key benefit we had as a country is that we had Sheila, who is the consultant under the BDB initiative, who was able to collect the evidence before we piloted this tool. But in cases where we don't have a consultant on board, then such information can be generated from program data progress report from the Breaking Down Barriers initiative in countries that have these initiatives ongoing. And so evidence can be generated from this information. In terms of when planning for the stakeholders meeting, there's a need to ensure that you have the materials beforehand so as to save on time. And we also noted the need to have enough time, for example, 2 to 3 days, so that then we can, the countries can be able to comprehensively address the issue. The key point that we noted, the other key lesson that we noted was around having the right stakeholders in the room, so that if you have some of the challenges that have been identified, if you have the right stakeholders in the room, you will be able to generate the evidence, yes, and also be able to prioritize the actions moving forward. So for example, if for a certain country, you believe that one of the key issues is around learners living with HIV having discrimination in schools, you need to have the Ministry of Education in the room, the Ministry of Health, communities in their diversity, and also technical working groups on education, depending on each country and how they operate. The other key lesson we learned is just ensuring that we are as inclusive as possible and having all the stakeholders that address issues to do with stigma and discrimination. And this enables to have enriched discussions and also improve the quality and insights and have ownership. So that by having inclusivity and ensuring that everyone is on board, including communities, the government, then that ownership is able to be created. We also noted that this tool can be able to be adapted to the local context and be able to reflect the local program and how we operate in terms of stigma and discrimination. Thank you, and over to you.
Thank you so much, Jane. Yeah, a lot of critical points on kind of how to ensure inclusivity and ownership of the tool. It is a tool for countries and the diverse stakeholders in the stigma and discrimination response. So speaking about one very important stakeholder in this tool and in the stigma and discrimination response in country, it's the communities. Communities of people living with HIV, communities of key populations, of young people, and to speak on to talk about that aspect. We have LCIA from NatPlus Ghana. Elsie, if you're able to unmute and share.
Hello.
Great. Welcome, Elsie. So we're going back to Ghana from Kenya. You and other community representatives were part of the pilot in Ghana that John spoke about earlier. From your experience, why should community leaders and networks be interested in this tool, and what should their role specifically be? Elsie? Elsie, maybe if your network is not working properly, you could. You could turn off your video, but I think we might have lost Elsie there. So we might, while she comes back on, maybe if I can put something that I think must be on everyone's mind at the moment is that in these very challenging circumstances, and when resources, I mean, as Laura said right at the start, resources for stigma and discrimination has never been easy, but in these circumstances that many countries are facing, and this I want to ask perhaps Jane to come in, and John, how will countries finance this tool? Elsie, is your network back? Maybe as
Yes, it's back.
Okay, let's come to you first, and John and Jane can think about the question that I just asked. So Elsie, did you hear the question? Basically, from your perspective, why should community organizations and leaders be interested in this tool, and what role should they play not just in Ghana but in other countries?
Okay, thank you very much for the opportunity to be part of this webinar and to share our experiences. I would like to say that communities are key, and we experience what we experience in our diversity. And what I used to see, or what we had seen happening in our country, was that when we're dealing with human rights issues, it wasn't what we saw as our issues, but it was what other people saw as human rights issues and what needed to be done. So for many years, I saw us just as communities, as members of NAPLAS, being present in a meeting, but knowing that we are just there but whatever it ends up with is not going to benefit us in any way. And that continued until we were able together to finish our stigma index study and do the analysis and the reports. And we realized that we actually spoke for ourselves. We realized that everything that came out, the results, was reflecting us as community, our diverse communities. And this was the beginning of us coming together, acknowledging that for once, we have come out with something for ourselves. And we saw that document as the basis for us to move ahead. Now here comes the stigma tool, opening the door wider for us to do what prioritize, because we don't want to shift from this document, this research that we had done by ourselves for ourselves. We don't want to shift our focus from there anywhere else. So now this tool has opened the door for us to prioritize. We were able to prioritize stigma as the first, but then we also came out with internalized stigma. But all the other things were important. How are we going to handle this? So this is a very wonderful tool for us, as we see it in Ghana, to help us prioritize based on the information we had received, what's of concern to us, what's the sources of stigma, all those things, and the settings. We've always been looking at the ourselves as PLHIVs, individual setting, within the family, and then within our community, not the geographical community, but communities of persons living with HIV, before we go to the geographical setting. But then we see people wanting us to do, or interested parties wanting us to do different settings, which for us are important, but that is not what we want. We are seeing that this tool is just making it very possible for us to do that, very possible for us to bring on board the key stakeholders that we feel would help us move ahead in addressing this issue of stigma. So for me, it is a very wonderful tool and it has a lot of opportunities. We are just starting. So during the pilot phase, we had one big issue which we were yet to address. We included it as one of the key things we wanted addressed, and that's a case that one of our members won in court, but she didn't get the redress that was supposed to be for 4 years. We put that there as something that was very key for us that we wanted done. And surprisingly, and to our joy, UNAIDS Ghana picked on it. And they are following the court case. A few days ago, I was asked for the court's the judgment and all that. The lady in question said she would go for it. She went for it herself. She sent the copies to us, and we shared them to our partners who have asked for them. And she is so happy that at last she would receive the just judgment that is her due. And I think this is an opening, because for us addressing this for this woman, we know other people have other issues that we can also use this tool to address. And we see this as also strengthening our community's faith in NAPLAS, in our ability to stand for ourselves, fight for what we want, and achieving what our goal. Many other stakeholders are with us, and we believe that they would also understand the need for us to do what we want for ourselves, and we'll tag on what they also want to do. After all, it's a partnership. We are collaborating. Yeah, so this is just what I want to say with much joy, that this tool has opened a door very wide for NAPLAS Ghana. Thank you.
I think that's very inspiring to hear. You know, you talk about the partnership, but how already this kind of a pilot in December already had a very kind of tangible outcome, and the key role of each partner, how UNAIDS Ghana stepped up and kind of really took this on. So kind of again, credit to the partnership in country, in all countries. So maybe back to who would like to go? Jane, would you like to kind of just briefly answer how can countries, you know, in these very difficult times, you know, when funds are limited, I think it'll be something that countries are asking. How can they resource? The tool does not require a lot of resources, but of course you talked about meeting for at least 2 or 3 days, having a consultant. Would either Jane or John like to kind of please feel free to unmute and respond? Go ahead, John.
Okay, so thank you. I think eventually it will come to government, but I think that it was Sheila who made the point that if this can be embedded within the national strategic plans and also other annual plans of the technical working group or the AIDS response, then that would be one way to have it ongoing. But I think for countries that are yet to even start, getting some kind of catalytic support will be crucial, because for those of us who have tried it, we've seen what it is, we've seen the benefits, but those yet to start, I think it's really important that either through existing funding mechanism or some form of ongoing initiatives, if there's any opportunity to integrate, that might be a good starting point. But ultimately, as I said, it is embedding it within the government processes and ongoing planning processes, both in the strategic plan, but also in the annual planning processes. Thank you.
Jane, would you like to add anything, or Sheila?
Yes, I would like to add. So for me, I think a country like Kenya, where we have already been able to receive the Global Fund resources for the next cycle, that is the GC7. We may not have an opportunity at the point of proposal writing, not at this time, but probably in future. But I think one of the key aspects that we can look at is around some of the human rights and gender activities that we had already planned for, and how then we can be able to ride on this to be able to kind of integrate this tool. So basically just riding on some of the activities that have been already been funded under the Breaking Down Barriers initiative. And we also know on the human rights and gender module, one of the key program area is around eliminating stigma and discrimination. And hence there are a number of activities that we had already budgeted for, and we are lucky then that we shall be receiving the resources. So we can be able to embed this tool moving forward on some of these activities. The other aspect is around just working with development partners and also other implementing partners that we can be able to explore with them on areas of funding and support. And I would also like to concur with what John said. For countries that are probably in the process of undertaking their global fund writing, then they have an opportunity to be able to integrate this tool moving forward. And I think also for Kenya, just like as in Ghana, our human rights and gender plan did come to an end in 2024. So we are looking forward to developing for the next couple of years. So we believe we shall also be able to integrate this. Thank you.
Thank you, both of you, for really kind of very practical ways of ensuring the sustainability and kind of the long-term use of this tool. We've had a question in the Q&A box, and then open to anybody who wants to, any of the panelists who want to speak on this. Does the tool also allow us to assess the financial investment in the fight against stigma? This is open to anybody. If not, I will take it. Would any of you like to respond? Including Alexandrina and Simone, you're welcome to. Alexandrina, go ahead.
I was waiting actually to hear from the experts, the people that make it happen on the ground. I think there are great examples of the programs that work in order to address stigma and discrimination. I would actually love to hear from John about the efforts that Ghana is currently doing around internalized stigma. Maybe just to mention that the Breaking Down Barriers progress assessments have captured some good examples of programs that work to address stigma and discrimination. I can drop in the chat the link to those reports, including to the report from the Democratic Republic of Congo, because there are some promising elements there. If we are to distill the elements of programs that work, it's always programs that put communities at the center and have community leadership in terms of addressing stigma and discrimination, be it through self-support groups or through concerted actions to address internalized stigma, or through human rights ambassadors or defenders or community paralegals, or ambassadors, including treatment ambassadors. So having that capacitated, strong community-led organizations at the heart of stigma and discrimination reduction really works. The Breaking Down Barriers progress assessments have also documented that programs such as Looking In, Looking Out, that address biases and attitudes, including healthcare providers and other duty bearers, are also really effective programs. So I won't bore you too much because I saw that John came on and I would love to hear from him, but I will drop the resources in the chat if useful.
Thank you, Alexandrina, that's for adding that detail. John?
No, thanks very much, Alexandrina. I think really, so in terms of, let me start first with the tool and whether it also assesses financial resources yes, in the management and resourcing and M&E, there's a whole component and a series of questions that assesses the financial and technical resources that are available for stigma and discrimination programs. And in terms of internalized stigma and really what Ghana has done, I'm sure my colleague Elsie will speak more, but or also Eunice, but generally the partnership has been such that building on the report, the stigma index that Madam Elsie mentioned, which really sort of zoom in on internal stigma as one of the major challenges. It was possible through the partnership with the Global Fund, with UNAIDS and other stakeholders to work with Beyond Stigma and Zandiri in bringing in starting a Wakakosha bootcamp and training for a group of young ladies here in Ghana. So really, I'm sure Madam Elsie might add a bit more to it, but that really is how, using the evidence generated from the stigma index and building on the partnerships and opportunities that exist, we're able to link up with Beyond Stigma and also Zandiri to have this started in country. Thank you.
Thank you, John. And I know we also have Eunice Mensah from UNAIDS in Ghana. And Eunice, if you would like to kind of add to that, and you already you must have heard Elsie kind of mention the role that UNAIDS Ghana played. Yeah, we can hear from you. Eunice, go ahead. But let me just unmute you.
Okay, hello, can everyone hear me, please?
Yes, we can hear you loud and clear.
Okay, great. So I'm always humbled to talk about this work because it was very exciting to see the actual impact on lives on the ground on internalized stigma, and working together with Nadine and her team from Beyond Stigma. They are an absolute joy to work with under the Dachi Project. So we ran the Dachi Project for women who we classified as having multiple intersecting identities of stigma. So you are a teenager who is also a sex worker, who is also a person living with HIV, or you are a mother who is also living with HIV, who also uses drugs. Those types of multiple intersecting identities. And we run a very rigorous program, including different tools from the start, M&E indicators, to do a pre and post assessment to see the actual implication of stigma in their lives before the project and after the project. And then we adapted it to the Ghanaian context, because Wakakosha actually means I am worth it. But in Ghana, we say mesombo, which means I am worth it again in Ghana. And we had amazing testimonials, human interest stories. We are currently running a month-long campaign on zero discrimination. And on International Women's Day, the girls from the Dachi Project themselves just decided to celebrate the women who had helped them on their journey by sharing how it had improved their adherence to treatment. They had created a peer support group to remind each other to take their medication. And all in all, we run this as a pilot, but we are really looking at scaling it across Ghana because it's very clear that the method works. And there are also a lot of lessons that we learned from that if we had the opportunity, we would do better. And I know that even working closely with Auntie Elsie and her team from NAPLAS and Juliana, it has been really, really impactful. So we're happy to talk about the work. We're happy to share all the documents. We have the concept notes, the M&E tools that we developed, the project reports itself, the outcomes, the stories from the girls. And we're happy to share that to the extent that anyone will find that useful. Thank you.
Thank you so much, Eunice. It's really we're humbled by all the inspiration and joy that all of you have brought to, just being able to do the pilot, but the examples that you all have provided of real progress as a result of your work on stigma and discrimination. I'm going to end this conversation by maybe a final question that whoever wants to kind of respond. How can this tool help countries, support countries to achieve the 10-10-10 goals and move forwards on that? Would anyone like to take that question before we close? Yeah, go ahead, Simone.
Yeah, thank you so much, Aditi. I think what everything has been said now just tells us the story. It's really very possible because we know that with the political commitment, when a country politically says we want to move forward with the stigma and eliminating stigma and discrimination, and that happens with also the financing with through the Global Fund breaking down barriers, you kind of have here the commitment and the resources, and coupling that, which is the most important, is the community voice. And the communities have been very critical in all of the processes with a country committing and moving forward with the implementation of the global partnership, or whether even the implementation of the breaking down barriers. So the angles that are critical and important to have to be able to reach the societal enabler targets, the 10-10-10, are already there. The idea now is how to zero on the prioritized actions that will take us forward. And that is the tool that will help us to do that. Also, the flagship initiatives and sharing those across countries. We don't want to reinvent the wheel. So what Eunice had said about the internalized stigma work, that's amazing. We already have that started in Ghana. Now moving that to another country would be easier than, like the heavy lifting that had started before. So I think all of those together could help us just try to ensure that we target we get closer to the 10-10-10. Also making sure that investments, countries commit to domestic investments. It's not enough to lean on donors. We need to make sure that when a country commits to an initiative or to a goal, there has to be some sort of also internal buy-in, and that is what those commitments, what those resource mobilization that's happening at the national level can help us do that. So I really am happy to be part of that conversation, and looking forward to also moving forward and ensuring other countries are adopting the tool. Over.
Thank you so much, Simone. And that's a really good way to kind of end this panel discussion. Really lots of practical ideas on how this tool has it is going to benefit country and has already kind of brought some benefit in Ghana and Kenya, and kind of great practical suggestions on how to ensure the long-term kind of sustainability of stigma and discrimination efforts, even in challenging circumstances. My colleague Laura is going to put up a slide shortly, and we're going to, we just wanted to share with you kind of the next, where you can find the QR code there. Is the tool, as she mentioned earlier, is going to be available on the IAS Plus site, and so will the recording of this webinar, and you can access it by using that QR code. We will also send out the details to all of you by email, so you'll be able to kind of access the entire tool and the accompanying guidance that goes with it. So look out for that email. Just to thank you all for making the time, and thank you particularly to all our speakers and panelists for sharing sharing all the lessons learned from piloting the tool and being part of developing this tool. We could really appreciate the journey that you have traveled with us to develop a tool that is hopefully going to be beneficial for countries to prioritize their work on HIV-related stigma and discrimination. Thank you, everybody.